I think we are going to live 150 years and we're going to be healthy. The future is looking for healthy longevity more than just live longer. And I think with the stem cells, with all the research we're doing with the peptides, are going to provide a lot of good information.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Martha Viera, a board-certified dermatologist with expertise in medical, cosmetic, integrative, and regenerative aesthetics dermatology. She's dedicated to helping patients achieve optimal skin health and overall wellness through personalized, evidence-based care. By combining advanced dermatological treatments with integrative and regenerative approaches, Dr. Viera focuses on promoting healthy aging, longevity, and natural rejuvenation from the inside out. Her practice involves innovative solutions for skin restoration, aesthetic enhancement, and preventative health in a compassionate and patient-centered environment. Dr. Viera is passionate about empowering her patients through education, individualized treatment plans, and a holistic approach to beauty and wellness. So Dr. Viera, welcome and glad to have you here.
Thank you, Daniel. Thank you so much. I'm happy to be in this beauty talk.
Yeah, so let's start from the very beginning. What first got you interested in the broad medical field?
So medical field, since I'm 6 years old, my dad was a doctor, so he was a surgeon and a pulmonologist. So since I was born, I was looking at patients and seeing medicines. So I used to play with my dad's expired medications and my dolls. So since I'm 6, I started saying that I wanted to be an ENT. Then I went to med school. I wanted to be OBGYN, and thankfully I ended up being a dermatologist.
Okay. And so now you have a practice out in Coral Gables. What prompted you to decide to start your own practice?
So many things. So I work with another practitioner, another dermatologist for almost 7 years. My kids were little. I didn't want to work full time. But within that practice, I started growing my own practice. And I was lucky enough to have that flexibility and that freedom to start growing. And at that time, when Instagram started, so I started seeing, I'm Venezuelan, I'm from Venezuela, so a lot of Venezuelan people started looking for me. And I started growing and I was ready to move on, that you get to a certain point. And at the practice that it was mostly skin cancer. And I wanted to do more integrative functional dermatology and aesthetics.
Okay, got it. So now that you have this practice, I want to talk about some of the most common treatments that your patients and your clients come to you for. Let's start off with the Sofwave. Can you please tell me, what is the Sofwave? What does it do? Why is it beneficial?
So Sofwave is a very popular treatment in my practice. I call it the number one biohacker of the skin because it's a device that is an ultrasound, but it's different than other ultrasounds technology. What it does is like heats up your tissue, your collagen, and it doesn't go beyond the skin. It goes deep into the deep dermis, what the collagen and the elastin is. And it tricks your body saying, okay, I'm heating up your tissue, so you need to build up more collagen, a new collagen. So that's what it does. So my patients love it because it doesn't have downtime, is effective for tightening, to stimulate collagens, to have a rejuvenated look without looking weird or looking done. They can go to the beach, they can go to it can be like a launch type of treatment that you can have your break and then go back to work and nobody knows it or notice it. So, and people like it because it's not invasive and it's effective. So that's why it's my number one kind of like biohacker, because I say biohacker because it kind of tricks your body to be younger.
Okay. Now, I'm sure you get this question all the time. Is it painful?
It can be without numbing, but we have our tricks. We do topical anesthesia. We do cooling. With the cooling, you don't feel the heat as much, and it's quick. It's like 1 second. So
Mhm.
it's very tolerable. I'm bad with pain, and believe me, I do it like 3 times a year.
Okay.
Mhm.
Now, with this, how often do your clients need to do this? Like, is it typically like several treatments over what period of time? Like, what's the recommended?
Well, it depends on the patient. I have patients from 28, 30 years old to 60. So it depends of your needs. I said to the younger patients, you can do it once a year and it's perfectly fine. When like after 45, the collagen drops dramatically. So, you're going to have more laxity, especially at this time that we're seeing those GLP-1 patients that drop weight a lot faster and they don't have the structure to they lose the fat, so they have a lot of laxity. Those patients are going to need at least 3 a year. So I tell them once every 3 months, 3 a year, and you're done.
Okay, got it. Now, I want to move over to melasma,
Oh,
and how you treat melasma. So let's start off with what is melasma, and then how do you treat it?
so melasma is one of the dark spots on your skin that mostly appears in pregnancy or when patients are taking hormonal replacement or they're taking birth control, and it's multifactorial. They say, oh, it's a sunspot. It's very different than the spot. It's very different than a freckle. It's very different than when you do like a treatment, you get a dark spot post-treatment. And the melasma is a condition, it's a chronic condition that has multifactorial and multiple causes. So that's why you have to, and that's why I think my patients do well on melasma because I have a multi and holistic approach.
Mm,
So it has a hormonal, so it's a dark spot on your skin, and it has a hormonal component. It has a aging component, a maturity component, and also the sun, the oxidation, the inflammation. A lot of my melasma patient has rosacea, so it has a lot of vascularity. So you have to take into account all those causes in order to treat it, successfully.
mm,
Because a lot of patients are frustrated because they treat the melasma, they clear up, and then they come back as soon as they see the sun.
mm,
Why? Because they're not taking care of the internal part of the problem. So what do? I give my patients antioxidant supplements. I do treatments with laser combined with intravenous vitamin C, glutathione, which are, super potent antioxidants, go straight to where you want to get it. And the patient not only get the vitamin C on the skin, it gets it systemically because you have systemic inflammation, especially where you're perimenopause or postmenopausal or during menopause. Those patients has a lot of inflammation that we need to help differently, not only with topicals. Of course, we're going to have skincare with antioxidants like vitamin C, niacinamide, and other, fading creams or brightening creams, but that's not enough. So that's why I do a multidisciplinary treatment.
okay, so this is the integrative part of it, where it's not just on the outside. Oh, I have this skin darkening. Oh, it must be a skin issue. It's okay. What's going on the inside? How can you prevent it moving forward?
Exactly,
Got
exactly. Remember, skin is talking to you.
it.
You can diagnose many things before they even are, in the blood work.
Okay. Now, I want to talk about the full face rejuvenation and kind of what goes on there. And because when we talk about full face, um, I think people have different conceptions about what it means full face. Is it just you're just doing topically? And we talked a little bit about the integrative part. So, what goes into a full face rejuvenation?
So I recently published a case that she's 60 and biologically she's 42. And age-wise, I would say she's like in the 40s as well. So I brought her back 20 years back. Why? Because she started doing so the full face, and I said also neck after a certain age. I start with a nutrition plan. I start with intravenous antioxidants. I start with supplements. She is on hormone replacement because she's in that age. The hormones are very important for the skin because when you start the perimenopause, menopause, your skin start like losing collagen, like crazy. At 25 years old, you lose 1% a year. At 50, you have already 25% of your collagen gone. So
Mm,
you have to help her with estrogen. So, and also on her, we did a plan. In a year, we did Sofwave one time. We did another devices like I have The photona is another laser that have different wavelengths. So I attack vascularity, I attack collagen, I attack creepiness, I attack like lifting. So with those synergistic devices, I I was able to build up collagen and to give her a younger look, not only from the outside, but also from the inside out.
Mm.
Also, I did on her biostimulations, which I don't use filler with hyaluronic acid that much. I still use them strategically, let's say on the lips and the areas that I cannot use the biostimulator with our other type of injectables. And these are biostimulators and actually not only looks better, tighter, and it has more structure. So if you lose a little bit of the volume, that can restore some of the volume. So it's a combination of many things.
Okay. And I want to kind of parlay that into the topic of regenerative medicine treatments. So is part of what you do also, is there a regenerative medicine component to it, but also kind of standalone, like what is regenerative medicine as well? So kind of, let's start with the first part, like as far as the full face rejuvenation, do you use anything regenerative medicine related in that treatment?
So with regenerative medicine, you can use all these devices and also the biostimulators. But also you can do, as I said, a protocol with IVs, antioxidant IV, and you can do the protocol directly to the patient. You can add some amino acids to stimulate better the protein, the collagen protein. You can also do peptides. I do a lot of topical peptides in the skincare, but also microneedling. We're using a lot of the tricooper peptides. The injectable peptides are tricky. I'm not against it because they're already FDA approved, but if you're a person that are interested on peptides, you have to go to somebody that knows how to do it, that knows the contraindications, that do blood work for you, because they work amazing. And there is one specifically, the GKHQ, which is we call it tricooper. It's amazing for the hair, it's amazing for the skin, it's amazing for melasma, it's amazing for rejuvenation, but you need to make sure that you are able to use it.
Okay. So, in peptides, I want to dive a little bit deeper into peptides because I think a lot of people are hearing about peptides and it seems like it's on social media and everywhere. It's kind of blowing up. But I think most people don't know really what a peptide is. Like if you ask like the average person, what's a peptide? Like, oh, I've seen it all over. Okay, but what is it? And they can't give an
Exactly.
answer. So I guess what is something that people need to be careful of when it comes to peptides? It seems like there's also a lot of influencers saying, oh, get this one and get this one and get this one. And it's almost like, well, is it a supplement? And like, if I take it, it's going to be fine. Or what's, I guess, the thing that people need to be aware of when it comes to peptides?
So peptides are short chains of like it's a series of amino acid, and they actually have different functions. So they send signals, okay, and they can send a signal to the pituitary or to stimulate hormone growth hormones. That's one, and then you have many different benefits like rejuvenation, you have muscle stimulation, you have to sleep better, for example, the tricooper, it helps for the skin because it sends a signal to the fibroblasts, which are the cells that produce the collagen, to be more efficient, stuff like that. But the main contraindication will be cancer. And you don't know if you have cancer if you don't study. Let's say you're 25, 30 years old, but you don't know if you're in 20 years, you're going to have prostate cancer, God forbid. But then you have to know where you have to do some certain questionnaires, certain tests, lab work. And then once you know that you're healthy and you're fine, you can do a protocol for 3 months and then change it. You cannot stay on the same peptides forever. You could, like GLP-1s, like all the GLP-1s, Ozempic, Wegovy, all those semaglutides are also peptides to lose weight, but you have to do with somebody that knows which one is the one that you need and if you need it, and then see what's your dose and see what's your maintenance. So those are very, very good, but you need to use it with somebody that knows. what are they doing? I have
Oh.
patients that come with ChatGPT and said, "Oh no, I got this in online Canadian pharmacy, and they send me already mixed the Tricooper, the ipamorelin, and the CB 500."
Mhm.
They're amazing, but you don't even know if you need those, and you don't even know if if you're gonna have problems in the future. So I'm 100% pro peptides done right.
Okay, got it. Now, when it comes to regenerative medicine, could you kind of define what is regenerative medicine and why is it so beneficial for people?
So it's actually working with your own biology, okay? It's understanding your physiology, your biology, and work with it. And you have tools of biohacking the accelerated oxidation inflammation that leads to a premature aging. For example, we have stem cells. I don't use stem cells, but they're in and they're coming up.
Mhm.
Stem cells, you can use your own. You can have a bank of stem cells, but that's tricky as well. So I'm waiting for more research data to come up. You have the peptides, they're regenerative. You have the IV intravenous protocols, depending of where you are. You have the hormone replacement. All of that is regenerative. Now, you can have regenerative aesthetics with devices, with biostimulation, with can I say some brands?
Yeah, if you want to.
Like Sculptra or Radius. Those are biostimulators here in the US. There are many others internationally, but we cannot use it here because of the FDA.
Mhm.
We can even mix those biostimulators with your own PRF and your own PRP, which is plasma-rich platelets. Those are regenerative. We use that a lot with exosomes. Exosomes are vesicles that create signals also to stimulate collagen production, stimulate hair growth, and we use protocols combined with PRP, your own plasma. We use also growth factors. There are many growth factors that we can use, and those are regenerative. You can use it like topically, or you can use it. But injectables are tricky in the US because it's not regulated, but you can use it as off-label. And then you have all these radio frequencies, all the ultrasound devices that stimulate your own collagen and it boosts your own biology. That's what regenerative medicine really is about.
Okay. Now, Dr. Vera, I know we kind of talked about a lot of different types of treatments, but across all of those, like I'm sure you get a lot of common misconceptions or myths that your clients come to you for. I mean, I know one of it is like the AI. Hey, I found this on ChatGPT. Can you do this for me? But what would you say are some of the most common misconceptions or myths that you hear about the treatments that you provide?
So a lot of people confuse Botox with filler and confuse the, let's say, oh, can I do Botox here in my lips? Can I do Botox like in my cheeks? Oh, I don't want to get Botox because I want to get like filled up. So
Mhm.
Botox is the toxin that makes the muscle relax and prevents the wrinkle because it prevents movement.
Mhm.
Filler, on the other side, is a gel, I would say, kind of device or product that has hyaluronic acid most of the time, and it fills the spaces. That's why I use it strategically because they can migrate, and these are two different functions. We combine it most of the time, but you don't, for example, you don't put filler on your forehead. There are
Mhm.
people they do.
Yeah.
It's tricky. I don't do it. I prefer biostimulation or other type of in the forehead. I use mostly devices and lasers. But there are people that use men, especially elderly men, some filler in the forehead. If
Mhm.
they use it with cannula, it's safe. So this is the most common misconception that I hear from my patients.
Got it. Okay. Now, let's say that, Dr. Vera, someone is looking to get some type of treatment done, whether it's the full face rejuvenation or Sofwave or anything in between. But they've never been to a place before. They don't have any friends or family that's in the industry. What is the most important piece of advice you can give to this person as they're doing their search so that they can find somebody, a dermatologist, who has experience, has a knowledge, and can really get them the end result they're looking for?
So I would say when you search with a provider, try to make sure there's an MD.
Mhm.
Um, I'm not against 2 mid-levels like PAs or nurse practitioner. I have in my office and they're very capable. But if you're going to do it for the first time, look for reference, look for reviews, and look for especially where they were trained.
Mm,
Because a lot of people is capable of doing the procedure. The problem is where it comes complications. If
mm,
it comes a complication and the person doesn't have the enough experience, they're not going to be able to help you. And that's the only reason I said just go first with a doctor that has more years of experience and knows and search of where they went to the school, how long they've been practicing, and any reviews, because that will give you a good idea.
got it. Okay. And when it comes to the future, where do you think the future of aesthetics is going?
Well, I think we are going to live 150 years and we're going to be healthy. The future is looking for healthy longevity more than just live longer. And I think with the stem cells, with all the research we're doing with the peptides, are going to provide a lot of good information with the hyperbaric machines. I do for my patients a program that I call it Skin Radiance, where I mix nutrition with nutrigenomics. We see your epigenetics because your genes doesn't. Let's say that you have a gene for cancer. That doesn't mean that you need to have cancer if we modify it with nutrition. So we do that here. We do your schedule for IVs. We do your schedule for your aesthetic procedures, and then I do infrared sauna, red light, cold plunges if you need it, depending of it's individualized. And we do a lot of hyperbaric machine, depending on the patient and the how to say lymphatic drainage. So with that combination, and this lasts 6 months. So I think more and more we're going to see this combination of approaches because you need to see your body as talk to your body, to your own biology, and kind of like modify the way it's going with inflammation, reverse that inflammation, and preserve your organs and system at the mitochondrial cellular level.
Yeah, so it sounds like it's a bright future ahead.
I think so.
Okay. And also with the future in mind, what is the vision you have for your practice?
So many things. There are many things coming. I think a lot of combination of the holistic approach is what is coming for me. The functional aspect of dermatology for me, it's what's coming more and more. Patients are looking for that. Patients are more savvy. Patients knows what they want, and also add a little bit of quantum medicine. I think that's coming too.
Okay, awesome. Well, Dr. Viera, I do have one last question for you, but before I ask it, I do want to point people to your website at vieramarthamd.com. Now,
Yes, and my Instagram is the same.
okay,
Viera
perfect.
Marta MD.
Now, last question for you. What does beauty mean to you?
Reflect what you're feeling inside. And my beauty slogan is be beautiful, be natural. So that's why my patients look for me, because they want to be themselves, but their younger version of themselves.
Mm.
So I try to keep it low profile, keep it natural, and make sure that your patient love from the inside out before they see in the mirror. Because no matter what you do, if they don't feel good with themselves, they're never they're never gonna find the look that they're looking for.
Okay, well said. And there you have it, Dr. Viera sharing your expertise. So, doctor, where can people contact you in your practice?
So my phone number is 305-239-5589. You can DM me on Instagram, Viera Marta MD, or you can go on my website and we have also a chat in the website.
Awesome. Well, Dr. Viera, this is awesome. Thank you for coming on. Thank you for sharing your knowledge, and thanks for sharing your message.
Thank you so much for this nice invitation, Dana. Good luck.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.